call the Minister for COVID vaccine deployment to make a statement. Mr. Nadhim Zahawi.
Thank you very much, Madam Deputy Speaker. Can I begin by thanking you, and with permission, I'd like to make a statement on coronavirus. But before I do that, I'd like to wish my shadow opposite number a happy birthday today. Our nation, Madam Deputy Speaker, is getting safer every day as more and more people get protected by the biggest immunisation programme in the history of our health service. Over 10 million people have now received their first dose of one of our coronavirus vaccines. This is almost 1 in 5 adults in the United Kingdom. We're vaccinating at scale, while at the same time retaining a close focus on the most vulnerable in our society, to make sure those at greater risk are at the forefront of the queue. I am pleased to inform the House that we have now vaccinated almost 9 in 10 over 80s in the UK, almost 9 in 10 over 75s, and over half of people in their 70s. We've also visited every eligible care home possible with older residents in England and have offered vaccinations to all their residents and staff. This means we are currently on track to meet our target of offering a vaccine to the 4 most vulnerable groups by mid-February. This is an incredible effort, Madam Deputy Speaker, and has drawn on the hard work of so many. And I want to just take a moment to thank every single person who has made this happen, the hundreds of thousands of volunteers up and down the country, the scientists, of course, our colleagues in the NHS, the GPs, the doctors, the nurses, the vaccinators, social care, the manufacturers, the local authorities, the armed forces, the civil servants who work night and day to make this deployment possible, and anyone else who has played a part in this huge logistical endeavour. It really is a combination of the best of the United Kingdom. At our time of national need, you have given us a big boost at our fight against this deadly virus, which remains a big threat to us all. There are still over 32,000 COVID patients in hospital, and the level of infection is still alarmingly high. So we must all stay vigilant and keep our resolve, while we keep expanding our vaccination programme so we can get more people protected even more quickly. Madam Deputy Speaker, we have an ambitious plan to do this. We're boosting our supply of vaccines, and our portfolio now stands at over 400 million doses, some of which will be manufactured in the United Kingdom. And we are opening more vaccination sites too. I'm pleased to inform the House that 39 new sites have opened their doors this week, along with 62 more pharmacy-led sites. This includes a church in Worcester, Selhurst Park, the home of Crystal Palace Football Club, and a fire station in Basingstoke, supported by firefighters and support staff from Hampshire Fire and Rescue Service. One of the greatest pleasures, Madam Deputy Speaker, for me over the past few months has been seeing the wide range of vaccination sites that have been set up right in the heart of our local communities. Cinemas, mosques, food courts, and so many other institutions have now been transformed into life-saving facilities, giving hope to people every day. Thanks to this rapid expansion, we have now established a major national infrastructure. There are now 89 large vaccination centres and 194 sites run by high street pharmacies, along with 1,000 GP-led services and over 250 hospital hubs. Today's announcement will mean that even more people will live close to a major vaccination site, so we can make vaccinating the most vulnerable even quicker and even simpler. Madam Deputy Speaker, we have always believed in the power of science and ingenuity to get us through this crisis, and I was pleased earlier this week to see compelling findings in the Lancet Medical Journal reinforcing the effectiveness of our Oxford AstraZeneca vaccine. It showed that the vaccine provides sustained protection of 76% during the 12-week interval between the first and second dose, and that the vaccine seems likely to reduce transmission to others by 2/3. This is, of course, really great news for us all, but we will not rest on our laurels. Madam Deputy Speaker, no one is really safe until the whole world is safe. Our scientific pioneers will keep innovating so we can help the whole world in our collective fight against this virus. I saw how wonderful and powerful this ingenuity could be when I was one of the thousands of volunteers who took part in the Novavax clinical trial, a trial that published very promising results a few days ago. Today, I'm pleased to announce another clinical trial, a world-first study that will help cement the United Kingdom's position as a global hub for vaccination research. This trial will look at whether different vaccines can be safely used for a 2-dose regime in the future to support a more flexible programme of immunisation. I want to just reinforce, Madam Deputy Speaker, that this is a year-long study and there are no current plans to change our existing vaccine programme, which will continue to use the same doses, but it will perform a vital role, helping the world understand whether different vaccines can be safely used. Our scientists have played a pivotal part in our response to this deadly virus, and once again they are leading the way, helping us to learn more about this virus and how we should respond. Madam Deputy Speaker, it has been heartwarming to see how excited so many people have been to get their vaccine and to see the work taking place in local communities to encourage people to come forward to get their jab. Honourable members, of course, have an important role to play too. I was heartened to see colleagues from all sides of the House coming together to encourage take-up within minority ethnic communities through a joint video which was posted on social media last week. 2 videos, I should add. The video rightly says MPs don't agree all the time, but on taking the vaccination, we do. I could not agree more, and I am grateful to every single honourable member who has come forward to support this national effort. We want to make it as easy as possible for colleagues to do so. This week we published a new resource for honourable members that provides more information on the vaccine rollout and what colleagues can do to increase the take-up of the vaccine in their constituencies. This is an extremely valuable resource, and I would urge all honourable members to take a look at and think about what they can do within their constituencies. Madam Deputy Speaker, our vaccination programme is our way out of this pandemic, but even though this programme is accelerating rapidly, and as the Chief Medical Officer said yesterday, we appear to be past the peak, this remains a deadly virus, and it will take time for the impact of vaccinations to be felt. So for now, we must all stand firm and keep following the steps that we know make a real big difference until the science can make us safe. And I commend the statement to the House.
Thank you. Happy birthday to the Honourable Member for Nottingham North. Mr Alex Norris.
Thank you, Madam Deputy Speaker. I'm grateful to the Minister for advance sight of his statement and for his kind words about my birthday and for yours as